Hi there, my name is Hannah Friedman, and I'm going to be presenting the ethical dilemma of vaccines today. Are vaccines an ethical dilemma? Yes. It goes back to the mandatory vaccine schedules that we have for people to be able to enter school. Should there be religious or personal exemptions? Do these vaccines cause harm? And then what does that mean for society as a whole? With this presentation, we will look at the ethical components, the legal aspects, social and political implications, the various stakeholders, as well as my personal opinion. Deep diving in ethics. Some of the ethical principles that go with vaccines are autonomy, beneficence, non-maleficence, and justice. So mandates. Do people have autonomy over vaccines? Do they have the right to choose if they get a vaccine or not, or have their children get vaccines? Can they attend public schools? Is there considerations of the parental choice? Do they have capacity to make the right decision for their children? Is it circumstantial? Does it depend on the person? Once again, and it goes back to like our society norms and expectations. If they don't get vaccinated, can they go out and be a part of public? Can they go shopping at the grocery store without wearing a mask? Um, does their life with the autonomy of getting a vaccine outweigh the other general public of justice of do the greater good that most people get vaccinated to prevent these diseases creeping back in and killing many? And it goes back to questioning this, and it's this whole debate, and it depends on the person that you talk to, which can mainly based out of beliefs. And then once again, we've had science to back this up, which we're going to talk about with the research of that. With the science and everything, we have come to the conclusion that vaccines are safe. They do prevent illness and diseases, and they save lives. But people have these beliefs that they're being forced to take these vaccines against their will, and that they don't believe in the science of doing good. And the huge autism debate, which we'll talk about later, it goes back to we have to reframe some of these society norms and expectations of what is the expectation. If you want autonomy, you still want to be a part of public, but what does that mean for you? Research, once again, we have a rigorous research expectation for vaccines. The CDC says it takes 10 to 15 years in the lab before you even reach trials. Autonomy plays a big part in the testing of the efficacy, due to because there was terrible trials such as the Tuskegee syphilis trial where they infected individuals intentionally with syphilis without their informed consent or knowing. So the autonomy of choosing to get infected with syphilis or not. Um, this led to the strict enforcement of regulations of research and the ethics of research, which we've talked about throughout this course. Um, beneficence is to do what's best. And as we talk about vaccine production, it is to prevent communicable diseases. And many of these diseases that we're trying to prevent is because they don't have effective treatment or a cure, such as the smallpox vaccine, which was developed in 1797. And it was by Dr. Edward Jenner, who vaccinated an 8-year-old by first starting off with cowpox, which is a less virulent form of smallpox. And then once he was inoculated with that, he then did smallpox. And he was the first kid to be vaccinated against smallpox, according to the World Health Organization. These practices have been around since 200 BC, noting in China that the 1500s they used dried up scabs and they ground them up and they blew them up people's noses to inoculate them. And that's once again from the World Health Organization. Next, we're going to talk about access. We have an issue with our healthcare consideration of everybody. Justice, once again, we want everybody to be on the same playing ground, but they're not. Does that go back to does one's autonomy choice outweigh the general public of protecting all? Um, especially for those that can't get the vaccines because of a medical condition. It goes back to the ethical debate about that. Once again, we talk about the social determinants of healthcare, which we have, and it's the ugly truth of that based on your race, economic status, even where you live, doesn't mean that you will get the access to care that you need or deserve. Vaccinations is no different of that. If you have health insurance, they do preventative care. But if you don't have health insurance, you have to pay for this vaccine. Well, what if you live 30 minutes away from the clinic and you don't have a car and there's no public transportation? How are you supposed to get that vaccination? So there's an argument of justice here of that should everybody have access to vaccines and it's at what cost? Who gets it? Who doesn't get it? And it goes back to if we want everybody to be protected, then we should offer it equally amongst everybody, and that everybody should have the same equal shot. But that goes back to the social determinants of health and the society norms and expectations, that there's a lot of change that we have to do there. Now we're going to talk about the legal aspects. Once again, we've talked about how ethics and legal systems go hand in hand. For vaccine laws, it boils down to the mandatory vaccinations and if it impedes the citizens' free will or autonomy. There's a lot of discussions about how vaccine mandates drive the public to mistrust science regulations because they are being forced to comply. And that goes back to they undermine the confidence in the science. And we saw this with the COVID when it came out. Next, the liability. Today, we're finding the balance between the right of autonomy versus protecting the public from infectious diseases. If someone goes out and is spreading the disease because they are not inoculated, they could be technically tried for bioterrorism, yet it would be very hard to prove that. But on a more real note, neglect, that parents can be tried for neglect if they do not choose to vaccinate their children and put them in harm's way of these diseases. Next, state laws. States hold the power. Each state has their own laws and regulations for vaccinations. Some are stricter than others. In the federal political environment, vaccinations have been a hot topic. And many changes have occurred since Trump and RFK have been in the domain. Individual states either made changes to allow it to make it easier for people to not receive vaccinations, including South Carolina, where no shock, we have seen one of the most drastic measles outbreaks of 997 confirmed cases, and that's of April of 2026, according to the South Carolina Department of Public Health. 29 other states have gone the opposite direction, and they have publicly denounced the federal vaccine guidelines that have changed with RFK, including Massachusetts, where they are a part of the Northeast Public Health Collaborative, where they adhere to the previous vaccine recommendations and where the American Academy of Pediatrics recommend those more rigorous vaccinations. Now, the federal regulations. FDA basically sets the standards for vaccine safety research and recommend the vaccine schedules. Once again, the states can kind of decide from there. The Supreme Court is also another federal regulation, is that they hear cases from the state, such as the legality of vaccines, such as the case in 1905, where Jacobson sued the state of Massachusetts to avoid being vaccinated against the smallpox or being fined. He argued it was against his 14th Amendment, but the Supreme Court ruled that the state had the right to enact these laws for the greater good of the public. The CDC also controls of the recommendations and to monitor the diseases. And then the funding is a huge part of the federal regulations, that the federal government provides funding to the states of where the immunization programs are going and how many vaccines are available. And with those cuts, obviously that affects of how many people are going to be vaccinated. Social implications. Once again, we've talked about how it begs the question of our society norms and expectations. We talked about the laws mandating vaccinations. Each state has their own. We talked about the 29 states that kind of have made their own. The big thing is public schooling and daycare. Each state requires children to be vaccinated to attend school, such as in Massachusetts. The daycare preschool children have to get the HIV, DDaP, polio, Hep B, MMR, and varicella. While they reach to the grades of 7 through 12, the kids need all of those, plus the Tdap and the meningococcal. And that's according to the Massachusetts Department of Public Health. Massachusetts has also made bills or laws, they're presenting laws to eliminate the religious exemptions due to the vaccine schedule. That this is because many people have used and abused this, that it's made it easier for people to refuse the vaccines for their children, basing it off of religious exemptions, even though they are not religious and they just want the choice of autonomy. It goes back to there are medical exemptions where you have to have a practicing physician has to determine if the vaccine could cause harm to the child if they received it. And that is much more difficult for people to receive. Once again, you have to have a valid reason of refusing the vaccine. And it goes back to the religion and personal. Should there be exemption choice? Depending on the state you live in, there are some that allow that, some that don't. People that are immunocompromised, this is why we have vaccinations, is to protect people that are immunocompromised. We talk about the herd immunity, where it basically means that if 90% of the population is vaccinated against the measles, we'll say, that 10% of individuals that aren't because they have cancer or they have a autoimmune disease that their body would literally attack itself if they got that vaccination and it would kill them, that it protects those 10% and the 90% create that herd immunity. Once again, people that are immunocompromised don't have the option of getting vaccinated. And if you talk to many of them, they would wish that they would, because they have to rely on the public to keep them safe. In today's world, many people are putting their own personal priorities over the public general. And so it goes back to, should people have the right of personal choice or religious choice? And it's a huge debate. Political implications. Once again, policy holders are there to make and create laws for or against vaccinations, and it comes down to the states. They introduce these bills based on their constituents and what they want and their desires, but also I feel like a lot of them have their own personal beliefs about it. And it depends on what state you live in. Some are more focused on personal rights versus some are more focused on the greater good or the justice of all. And there's vast differences. As we discussed earlier, there's science to back up the vaccine mandates, but with these mandates, the mistrust has grown with the lack of confidence in science, especially what we've been seeing with the federal politics, including the science that fits their arguments. The major debate is whether vaccinations cause autism, which has been publicly disputed numerous times by science and much research, yet people have chosen to cling on to that idea and the belief. So they're choosing their belief system over science. CBS 60 Minutes actually did a segment on the vaccine court, which was established in the 1980s as part of the National Vaccine Injury Compensation Program, for its studies and decides if a vaccine actually caused harm to those that claim a vaccine did. This showed how rare it is for individuals to actually get an injury from vaccines. That as of April of 2026, only 14,409 individuals have been ruled having a vaccine harm. And that and this is from the 1980s to 2026, is that there's only 14,000 individuals. But it shows that people still believe that autism causes this. But this vaccine court, they rely on the science and the research that, once again, vaccines do not cause autism, that autism is much more of a genetic component versus a outcome from a disease. Um, and there's a lot of discussion now currently if that RFK changes that to say that overall he rules that autism is caused by vaccines, that this could be affected and it could affect those people that actually had an injury from vaccinations versus the people that believe they had a injury from a vaccination. And just to touch back on that, is that this program was invented to actually compensate those who actually had an injury from the vaccine, and it's a federal program. And they did this because it's easier for these people to come to this court to present their case and have these people that are very and experienced. So there's lawyers and doctors that are both on this program, and they rule and they go and they study each person and they look at it. It was very eye-opening. You should watch it. Next, we're going to talk about the stakeholders. These are the different stakeholders. Once again, we've talked about multiple of them. Obviously, healthcare is involved because we're administering it. And we also take care of the people that don't get the vaccinations or the people that are immunocompromised, and that we're trying to protect everybody and try to care for everybody. And then public health officials are huge because, once again, they're trying to keep the general public healthy. My opinion, finally. I think you probably have picked it up, but vaccines prevent illness, vaccines save lives. Um, and I am a huge believer in vaccines. I think, coming from a science background and a healthcare background, of that, I care for people. That is my job. And I personally haven't had to take care of someone that had been affected by these diseases, but I know nurses that have. And it is heart wrenching to see a baby die from measles because they couldn't get the vaccine. And there's all these other people that willingly chose not to, and it infected this child. I go back to that. A lot of people haven't had experienced hardship in our society because of all the science that we have done. We've had vaccines around forever now, and we just take it with a grain of salt that we're lucky to have it. But people don't understand how lucky we are. That if you go back into history in the 1800s, people were dying at outrageous numbers for these diseases, and they would kill to have a vaccination available. They would roll over in their graves to see people willingly choose not to because they're afraid of a belief that they have in their head. I think the other thing is that COVID once again bred a lot of mistrust in healthcare, in the science, and the research that goes behind vaccines. But people are going to make their own choices, and we're going to rock and roll it, and we're going to see how it all turns out. We're just here for the long ride, but as a healthcare provider, it's really hard to watch people study a belief versus the science that's right in front of their face. It goes back to the autism data. I have two brothers that have autism. I'm a firm believer that no vaccine gave them that, and that no vaccine gives autism, that it's just a genetic disorder and that you get it. And you're lucky if you get it, and you're lucky if you don't. So you're still a person and you're alive and you're not dying from measles. Herd immunity, once again, is a huge science driven. We have science based evidence that herd immunity works. I think we also need to provide education on things, but it goes back to people are going to believe what they want to believe, even if the data and the science is in front of them. And I go back to beneficence, of that we need to focus on the public good, of that you can think about how you fit into the public, but you fit into the public, and that if you want to interact with the public and be a part of society, that sometimes you have to bend and fold into it. And that means that you take vaccinations that have been proven over years that they've been safe and effective. And if you don't want to, that you're going to have these stipulations, such as wearing a mask, or that you're not going to be able to attend or participate in some of the public domains that we have. Um, that I'm all for autonomy, but also if your autonomy trumps someone else's life, especially the greater good, I think there should be some questions there. And I'm sorry for how long this presentation was. I really tried, but there was so much information. And here's all my references. And I will also submit my PowerPoint for more detail for you to look at. Thank you.